Etiology. The encephalitis from an ancient Hebrew encephalos means brain and is an acute inflammation of the brain. And the encephalitis with meningitis is known as the meningoencephalitis. So, it's an acute inflammation of the brain is known as the encephalitis. And meningitis with encephalitis is known as meningoencephalitis. Incidence in Western countries, the incidence is 7.4 cases per 1 lakh population per year, and in tropical countries, the incidence is 6.34 per 1 lakh population per year, and in 2030, there is 77,000 deaths from encephalitis from 92,000 in 1990. The cases decreased by the years. Now to the etiological factors. There are mainly the viral causes, bacterial causes, fungal causes, and the autoimmune causes. So, the viral causes means the HSV encephalitis and the arthropod-borne virus encephalitis. The other things which we have already discussed, the meningitis, bacterial, fungal, and the autoimmune causes will be the main causes which is leading to the encephalitis. So, on here we are going to discuss the herpes simplex virus encephalitis. It is caused by the herpes simplex virus, and it is of again divided to two types, that is HSV1 typically affects the children and adults, and the HSV2 that is common in the neonates. These are the two types, HSV1 and the HSV2. Then the treatment is with the for the as the virus is an infection, the acyclovir or the daniclovir is the main drug of choice. The next one is the arbovirus encephalitis. Arbovirus means arthropod-borne virus belongs to that's the arbovirus, and it belongs to several family of viruses, and most commonly due to the mosquito bite, the infection will be getting to the human, and usually it increases in summer and the autumn when the mosquito increases. As you know, during the summer season and the autumn season, there will be increased number of mosquitoes in the environment, and it will be the leading cause for increasing the incidence during that particular period. And it is diagnosed by serological antigen antibody of the blood or CSF, and the treatment is no specific medication is prescribed for the particular case. There is no specific treatment, but we have to do the symptomatic management. Then the Japanese encephalitis. Japanese encephalitis is a flavivirus, and it's spread by the mosquitoes itself, and there is no cure for the disease, and the treatment is focused on relieving severe clinical signs and supporting the patient to overcome the infection. Here we are focusing to supporting the patient to get relief from the infections, and we have to improve the or support the patient to overcome the infection. Safe and effective vaccines are available to prevent the Japanese encephalitis, and once we are getting vaccinated means then the incidence can be reduced. And the WHO recommends JE vaccine in all regions where the disease is a recognized public health problem. Mainly those areas having the in this case is a public health problem. Those population in the particular area should be vaccinated against the particular case. Coming to the clinical manifestations. Younger children or the infants will be developing the irritability, then poor appetite, fever, drowsy or confused patients. Means there will be irritability, then poor appetite, fever, drowsy or confused patients. Then in case of adults, there will be acute onset of fever, headache, confusion, seizure and malaise. As we already discussed, the meningitis similar itself, there will be headache, confusion, seizure, malaise, and the acute onset of fever will be there, as it is an infectious case. Then there will be cranial nerve dysfunction, then hemiparesis, dysphagia, change in LOC, increased ICP related to the hydrocephalus. Means when there is an infection, there will be formation of the edema, and it should be resulting in the hydrocephalus, and that in turn resulting in the ICP will be getting increased. coming to the assessment and the diagnosis, mainly we can go with the MRI to determine the inflammation, then EEG, then lumbar puncture, then blood test, and the urine analysis. These are the main things. MRI can be done, then EEG, then lumbar puncture, blood test. So these are the main assessment or the diagnostic tools how to rule out the case. Then coming to the complications. As we already discussed in the meningitis, there will be risk for seizure formation, then there will be learning difficulty in children, then there will be behavioral difficulty, then hemiparesis and death. These are some of the complications. Seizure will be the learning difficulty in children, then behavioral difficulty, hemiparesis, and may cause death also. Means, in case of the infection, once it reaches the sepsis case or modes of cells, means that will be developing the or it will be leading to death. That's the thing. Then coming to the medical management, the treatment which is based on the supportive care means we already discussed there is no specific medicine. We have to give the supportive treatment for such cases, and the main course is as follows. That is, we have to go with the antiviral medication if virus is the cause, cyclovir and ganiclovir and all. Then antibiotics if the bacteria is the cause. Means, according to the bacteria. Once it is a resistance having organism, then we have to go with the vancomycin and all. According to the type of bacteria and its characteristics, we have to use the specific antibiotics. Then we can go with the steroids also. These are some of the medicines what we are using in case of. Then the sedatives for restlessness. Once the patient is having the restlessness, then we can use the sedatives in order to reduce or in order to calm down the patient to a normal state. Then we can use the acetaminophen for fever and the physical therapy if brain is affected and post-infection. Means once the patient is having the cranial nerve problems and the patient is having the movement problems and all, then we can use the physical therapy to improve the particular functioning of the body parts. Then coming to the nursing management. So first we have to go with the assessment, and what we have to do is we have to admission history and the physical examination has to be done. We have to go with the baseline vital signs, then ongoing assessment for disease progression is critical. Means once the patient is getting admitted to the hospital, we have to take care of the patient and we have to thoroughly monitor the patient to know whether it is progressing or declining. What is the status of the particular case that we have to continuously assess. If the patient is monitored for life-threatening complications, that is, the patient is developing the respiratory failure or other complications that we have to monitor. And the main thing is assessment. From the admission to discharge, we have to be more careful and we should do frequent assessment. Then coming to the nursing diagnosis. First one is the ineffective gas exchange related to decreased tissue perfusion, then impaired physical mobility related to paralysis or fatigue, then pain related to disease condition, then altered nutrition less than body requirement related to dysphagia or the cranial nerve dysfunction. Then high risk for injury related to seizure episodes, then impaired verbal communication related to cranial nerve dysfunction, then fear and anxiety related to loss of control and paralysis, then potential for secondary complications, that is infectious, etc. These are the things. Then we have to maintain the respiratory function and we have to assess the respiratory rate and quality frequently, then monitor the perfusion with pulse oximetry, then monitor the patient for respiratory insufficiency, then ventilator support and the oxygen therapy. Then this physiotherapy has to be done. Then elevation of the head of the bed, which will be helping to improve the oxygenation. And then we have to monitor the vitals and we have to do frequent suctioning in order to prevent the further complications. Then reducing effects of physical mobility. That is, we have to change the position position every second hourly. Once we are changing the position frequently, then that will be helping to improve the patient confidence and all, and it will be helping to prevent the further complications also. And we have to support the paralyzed extremities in the functional position, and the patient should have a feeling of having some functions with their body parts. Then only their confidence will be improving, and they will be trying to utilize their body parts, or trying to use the arms or legs and just like that. Then you have to provide the ROM exercises every second hourly in order to improve the functioning, and you have to use the comfort devices according to the patient condition. Then we have to maintain the adequate nutrition and hydration, and we have to use the elastic stockings. Means once we are using the elastic stocking, what's the benefit? We can reduce the DVT formation. That means the deep vein thrombosis. We are using the elastic stocking, means that will be helping to improve the circulation in and out from the legs, and which will be helping to prevent the clot formation, and that improve the patient body condition, and also helps to prevent the further complications. And we can provide the massage also. That also helps to prevent the DVT formation. And hygiene maintenance is another other important thing. Means we have to keep the patient more hygienic. These are some of the main nursing interventions. And the nutritional support means what we can do is we have to provide the NG tube feeding when the patient is not able to take the enteral feeding. Then we have to assess for the bowel sounds. What about the bowel sounds, and whether it is increased or decreased, what's the reaction at the particular moment that we have to assess. Then we have to check the weight of the patient. Means once we are monitoring the weight daily, then we can analyze whether the patient is getting overweight or not, what's happening to the body. Then we have to go for the total parenteral nutrition if needed. Once the patient is not getting the means enteral or NG feeding, then we can use the TPN, and once the patient is having any electrolyte problems or the according to the chemical composition and other things, we have to look for the TPN as per the patient needs. Then we have to assess for the return of the gag reflex and bowel sounds before receiving the oral nutrition. Means once we are giving the patient via NG tube or TPN, means then we have to assess the patient's ability to have the swallowing or through the checking the gag reflex, and then we have to go with resume the oral nutrition only. Then we have to look for the intake and output. Means daily intake and output should be monitored, and then only we can identify the proper functioning of the proper fluid volume balance by the body. So that's one of the important things to be done. And improving the communication. Means for improving the communication, we can go with the lip reading. Once the patient is not able to speak, then we have to go with the lip reading. Then use of the picture cards. Means when the patient message has to be conveyed to the medical team or the patient bystanders by using the picture cards, or we can go with the speech therapy once the patient is having the slurred speech, and we have to use the pen and paper. Means but once the patient is able to write, then we can use the pen and paper method. Means that we have to give the patient a piece of paper and pen, and the patient can write the message in that particular paper. That's the different things what we have to use for improving the communication. That is lip reading, then use of the picture cards, then speech therapy, and giving the pen and paper. Then relieving the fear and anxiety. That is providing the information about the patient condition, and we have to provide the positive appraisal and encouraging the relaxation exercises and positive feedback. These are the things what we have to do in case of it, or to reduce the fear and anxiety, and clear the doubts and manage